Welcome to the Decluttering of Diabetes webinar. I'm receiving very interesting questions and I'm trying to solve as many doubts and queries that I can. I receive questions on diabetes type 1 and another question on the diabetes foot ulcer. So in type 1, let us be very clear in terms of its pathogenesis. Type 1 diabetes is an autoimmune destructive process where autoantibodies will destroy the beta cells of the pancreas. Remember, for your sugars to go high, minimum of 50% of our pancreatic beta cells have to stop functioning or get destroyed. That will be the time where you will start developing what we call glucose intolerance. But in type 1 diabetes, remember, more than 90% of your pancreatic beta cell mass is destroyed. And therefore you have a huge surge of glucose happening in the blood, which is usually very abrupt after a viral infection. So when there is no tissue that generates insulin, then there is no possibility of thinking of a cure in type 1 diabetes. Also, secondly, I advise all my patients with type 1 diabetes who come with a very unrealistic expectation of stopping insulin. I tell them it is not possible to stop insulin. This clarification at the onset of the treatment will set a realistic expectation from the case, from the system of homeopathy, by the homeopath himself and by the patient. This will save the homeopath from unnecessary demands from the patients, also protect you from any other medico-legal problems. So remember, in type 1 diabetes, there is a lot other things that you need to see other than your insulin level. Insulin is a life-saving hormone and one cannot function without it. So in type 1 diabetes, do not try to stop insulin. This is a categorical warning to anybody who is listening to this video. May it be patients, may it be homeopathic physicians, students. So this is going to be our limitation in type 1, but there is a lot to offer in type 1 diabetes with homeopathy as an integrated care system. We will discuss this at some other time in another webinar to follow the first one. So keep watching this space. We will talk a lot more on type 1 diabetes.